Thank you for joining us today. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Today, the Orange County Healthcare Agency reported that we have a total of 1,079 confirmed cases of COVID-19 and 17 deaths. As we hit over 1,000 cases, my heart and prayers go out to all of the patients and their beloved ones that have been affected by this virus. Despite the gradual increase in cases we have seen in Orange County, the number of those hospitalized with COVID-19 remain comparatively low. As of today, we have 127 hospitalizations and 63 in ICU. Please know that your county is working hard to assist you during this time and in the months to come. Under my guidance, the county has launched a comprehensive list of resources to better assist Orange County's residents that may be found at covid19info.ocgov.com. Here in Orange County, we need more help for our local communities and businesses. More than 400,000 small business loans were approved in the past week throughout the country, but so many more are in need of aid. In Washington, there are discussions about more funding for small businesses. As I have said, small businesses and their employees across America and here in Orange County are in need of help. I urge Congress to please set aside partisan bickering and ensure that our small businesses and their employees have the assistance they need. While we continue to fight the COVID-19 pandemic, we at the county will continue doing what we can here at home to focus on the future. I know we will beat the coronavirus, but our economy has to recover. That is why at Tuesday's board meeting, I directed the county staff to prepare and plan for an ad hoc committee of the Board of Supervisors to work with Orange County business leaders to ensure that we help these small businesses bounce back fast so all of our hardworking employees get back to work and their normal lives. This committee is going to be looking at many factors. One area, family-owned businesses, are particular concern to me. I used to own a small restaurant with my mom years ago, and I know how tough it is to open back up after closing down or limiting services. Helping these family-owned businesses get back on their feet are of personal concerns to me, and that is going to be an important part of this committee focus. Today's press conference will have Orange County District Attorney Todd Spitzer discussing his actions to protect residents from COVID-19 scams, as well as an update from Dr. Nicole Quick on her recommendation regarding face masks. It is the responsibility of the Board of Supervisors to ensure the safety and security of all of Orange County's residents, and it is my hope that Orange County residents take proper precautions to protect their health and welfare during this time. Again, I appreciate you all joining us today, and welcome District Attorney Todd Spitzer.
Well, thank you very much, Madam Chair, and to the whole Board of Supervisors. I really want to thank Frank Kim, who's also here, the CEO of the county council, who is advising all of us on a constant basis, the healthcare agency, who's doing so much frontline work, and the doctors, of course, Dr. Quick and her staff, social services, who's trying to provide much needed services to the community, and all the county departments. I just have to tell you, as an employee of this county for 30 years, I am just absolutely impressed and amazed by what people are doing to protect our community, and I especially want to thank the community. We're all locked up in our homes, and we're experiencing things we've never experienced before. I know people are getting very, very frustrated and very impatient, but I want you to think about this. As you flatten the curve extends out further, and that's what we're hearing now, that we're not necessarily in California going to have a peak, but we're going to be at least constrained longer, because as you flatten out the curve, it extends longer. My comments are going to talk about that and some of the things we're experiencing as a society, especially in the criminal justice arena. And so I want to talk about that today, and I want to thank the chairwoman of the Board of Supervisors for inviting me today. I know it's not necessarily hard to believe, but people will exploit the public for financial gain during a pandemic. And we created a hotline, which you can see behind me, and you can see the number. And the number is 714-834-3482. It's a coronavirus scam hotline, and it's designed to allow you to report suspicious activity. I'm going to explain some of the intricacies of these various scams that are going on, but if you're in doubt, I just want you to make a phone call. There's 800 employees in the Orange County District Attorney's Office. We have 150 District Attorney investigators, and they're specifically trained to investigate these kinds of crimes. So allow us to do our job, and if you'd use the tip line, we would very, very much appreciate that. So the number behind me, please make sure you write that down. To date, we've received in Orange County 130 complaints, specifically about the overcharging for water, toilet paper, the use of non-FDA approved testing. You've heard or read in the paper about a serology exam. I know Dr. Quick and others have talked about it before. There's various tests. One's a blood test, one is swabs in the nose, and what we want you to appreciate is some have been approved by the FDA and others have not. The job of the District Attorney's Office is to determine whether there's been a misrepresentation about FDA approval during the administration or the attempted administration of that test. The FDA is responsible for enforcing the actual misuse or possession of an unapproved test. So I just want you to understand, when you file those complaints with us, we will look into those, and then if it's not our jurisdiction, we will certainly refer that to the federal government. This situation obviously is very, very stressful. A lot of people have lost their jobs. People are struggling, we know that. It is impossible for some to even put food on the table and buying basic necessities. My job is to make sure that you can buy necessities at a fair price. So I want to talk specifically at this point about price gouging. And I'm going to use a couple examples so that you can understand what price gouging is and what price gouging isn't. So for example, I received, here's two things, the commodity, right? I mean, a simple thing is a roll of toilet paper, which before this pandemic, we obviously took for granted. And of course, these face masks. Let me give you an example of face mask. You may have read that city of Baldwin in West Covina area, LA County, they arrested a man who was selling masks for $300 a box. In that particular case, those masks, which is very similar to the one I'm holding, they're about $1 a piece when you used to buy them, say, at Home Depot or Lowe's. He was selling these for about $15 a piece. So he was increasing the price from $1 to $15. That, under any definition of the law, is price gouging. But let me explain how the law works. If you have produced or sold a commodity before the pandemic, there was a price in the marketplace. These were $1. After the crisis began, there was a run on these masks, and of course, the price increased based upon scarcity. So the law allows a merchant who has already sold these masks to raise their price 10% because of the increased demand. That's okay. What it doesn't allow is it doesn't allow somebody to price gouge, and that's specifically defined as no more than 10%. But again, let's say, for example, these masks are so hard to get that the person who's already sold the masks cannot get them, or they have to pay $10 a mask, and they still buy them. They are now allowed to charge $10 plus 10% on top of that. So just because you're seeing an increase, it doesn't mean that that's price gouging. Somebody may have paid more for that mask. The other thing, there's a loophole in the law. And Senator Umberg and I have been working on legislation to close that loophole. Under the law today, you have had to have already been in the business of selling these masks before the pandemic. So if you became an entrepreneur, in other words, you saw an opportunity to make money and you bought up all these masks, but you never sold the masks in the marketplace before, you could not be prosecuted irrespective of the price you charged. However, Governor Newsom implemented an emergency order where he covered that loophole under his emergency order. Now, when you pay $1 for this mask, you can charge up to $1.50. You're allowed to increase your price by 50%. So the guy in Baldwin Park that raised it from $1 to $15, he can still be prosecuted because that's greater than 50%. Senator Umberg, through his leadership, we will close that loophole through a state law. We don't need it right now because of Governor Newsom's order. Let me give you an example about toilet paper. So our office received a call that a convenience store was selling a roll of toilet paper just like this for $2.99. Everybody's like, my gosh, toilet paper is no more than 50 cents a roll. That must be price gouging. The question I would ask for you, how many times have you bought your toilet paper at your corner convenience store? Most people don't. The fact of the matter is, toilet paper has always been $2.99 at the convenience store. Even though you might go to a big box like I do and buy 30 rolls at a time, they can sell it at that price because they sold it at that price before. Now, if they pay more because their supplier is charging more, they're allowed to do that as well, as long as they don't charge more than 10% of what they charged before. So I guess what I'm trying to make sure is clear today is this is very complicated. It can be extremely complicated, and there's an analysis that has to take place. So if you're unsure, call the hotline and let us do our job and investigate that. I want to talk next about testing. I covered it a little bit, but we have received a lot of complaints about testing. If you've listened to President Trump's press conferences, he has been very eager to experiment with other drugs that are already on the market to see if they have applications. The FDA has been very aggressive about allowing tested products and even non-tested products to be in the marketplace because we have a shortage. We are not the enforcement agency to license or approve testing. We are only there to prosecute somebody if they misrepresent that the test does either certain things it does not, or that it has FDA approval when it does not. Call the hotline. I want to talk about United States mail. Many of you might be receiving checks as a result of assistance from the U.S. government. Either people are going to be stealing your mail, or they're going to figure out some scam to try to get those checks. So make sure you protect your mail. Let me talk about email. If you get an email from a charity asking for money, I do not want you to open up any attachment on your email. Most of those individuals are not legitimate and they're phishing. That means they're looking for a way to take over your computer. The California Attorney General has a website with legitimate charities on its website with their website address. The best protection, if you'd like to donate, is to call the charity directly. Do not open those emails. They could be a scam. Let me talk about the IRS. For years, we've all been getting phone calls from people representing themselves to be from the Internal Revenue Service. The Internal Revenue Service will never call you. They will never ask for your private information. So do not fall into that scam. Just hang up the phone, and if you're concerned about it, because it would concern you on the natural, if you got some question about your audit or being audited or anything about late taxes, make sure you call that agency. Lastly, I want to talk about something that's extremely important. That is child abuse and elder abuse. One of the things we're going to learn after this pandemic is over is that by having people shelter at home, we have potentially put children and elderly people closer to their abusers. I need you to think about that. Elder abuse reporting is down 68% in Orange County. Child abuse is down reporting 45% in Orange County. The reason for that is, think about it. The elderly go to their banks, and if they were to take out money, say because one of their kids was trying to take over their accounts, the bank people have to report that. They're what's called a mandatory reporter. When your kid goes to school, the nurse and the teacher can report bruises and other kinds of abuse because they're a mandatory reporter. With the banks closed and the schools closed, the people we love the most are the most susceptible to abuse. So if you're in a store and you see a kid with bruises, or a child that looks disheveled, or a kid that just isn't acting normal, I want you to report it. If you see an elderly person taking a walk and they look like something is amiss, I want you to inquire, keep your distance, and ask them if they're okay. I know it might feel like we're asking you to intrude in people's personal lives, but today we do not have mandatory reporters available to report abuse. I'd much rather have you call the Department of Social Services, have them look into it, and have it be inconclusive than not report it at all and a child was abused or an elderly person's bank account was liquidated. That would be horrible for all of us. So God bless you. God bless our county. God bless really the United States of America and the world, and for everything everybody is doing. You are doing phenomenal, amazing jobs. You're sticking together. You're doing what we need you to do, and I can't thank you enough on behalf of the Orange County District Attorney's Office. At this time, I'd like to introduce a very familiar face, a person who's been giving us regular briefings with a tremendous amount of credibility, Dr. Quick.
Thank you and good afternoon. I'm Dr. Nicole Quick, County Health Officer. Earlier today, we released some guidance that I put out regarding face coverings. The guidance recommends strongly that essential workers wear a face covering while engaged with contact with the public or coworkers, as well as that the general Orange County residents wear a face covering when engaged in essential activities. I want to be clear about what these face coverings are and are not. The face coverings we are referring to in the guidance relate to a cloth face covering that can be worn. It can be made out of a variety of materials, can be made at home or purchased. What these face coverings are not are the N95 respirators and surgical masks, which our first responders and healthcare providers need, and which we all know are under critical shortage right now. In general, this recommendation is in line with guidance from the California Department of Public Health as well as the CDC. The goal in issuing this recommendation for residents as well as essential workers to utilize face coverings is hopefully to add another tool in our kit to slowing the spread of C19 in Orange County. Face coverings help protect your neighbors from any potential respiratory particles that you are breathing out, and can be useful, but are not sort of to be used instead of these other basic measures that you've heard us speak about over and over again. Once again, social distancing, so remaining at least 6 feet away from others, washing hands frequently, covering any coughs or sneezes, and very importantly, staying home unless you are engaged in essential work and or going out for essential activities remains critical. We are hopeful about how our response has been in Orange County. I want to thank everybody with their cooperation with staying home and helping to protect our neighbors that are most vulnerable. Thank you.
Good afternoon. I'm Frank Kim. I'm the County Executive Officer. I think this is a good time for us to pause and take questions from the media. Moderator, do we have questions from the media queued?
Yes, the first question comes from the line of Nick Gerda. Please go ahead. Hi, thank you all again for taking questions. I had a question for Dr. Quick regarding the county's projections for hospital needs during the surge. Under the Cornell model run by Kaiser that you and others have been monitoring, currently there's 673 intensive care beds in Orange County, at Orange County Hospital. The middle projection on the surge model says there would be a need for 929 ICU beds, and the top estimate is about 4,700, 4,800 ICU beds, which is thousands more than currently exist in Orange County and are being planned for. Two questions. With social distancing now being pretty widely followed, do you consider the higher estimates in that Cornell model to be unlikely at this point? And in your view, how many ICU beds, hospital beds, and ventilators should be in place in Orange County when the surge hits?
Sure, thank you for the question. What I would like to say about modeling is that we continue to run various publicly available models almost on a daily basis right now. And the reason we do that is these models change projection-wise based on a lot of the details on what our daily case counts are doing. I want to make a comment on that as well. The daily case counts that you see posted on our website, it's important to follow those as a trend. So you will see some fluctuation on a daily basis in the reported number of cases. And what we are most concerned about is the trend. Overall, we believe our trend is headed in the right direction, and that's related to the number of new cases we've seen over a period of time. So back to the modeling question, we continue to run models on a daily basis. We are basing our response on the idea of planning for a surge in our healthcare system, and we are working actively with the state as well as our region to ensure that we have enough hospital beds, ICU beds to meet this. As far as specific numbers to that question that you asked, I do not have that model in front of me right now. We are actively working with the state to make sure that our number of surge beds is consistent with what they need for the region. Thank you.
Yeah, thank you. And a quick follow-up on the kind of the apparent flattening of the curve. Do you believe in your medical estimation that part of that may be because of kind of the throughput maximum currently being reached on new testing per day that could kind of level off the number of new cases each day simply because of the continued shortage of testing across Orange County, the state, and nationally? Or do you believe that this leveling off of new cases is a true reflection of leveling off of actual new cases?
Sure, a couple comments on that. We definitely all know that there is a shortage in capacity of testing across the U.S., state of California, Orange County as well. We one of the things we look at is a measure of the number of positive tests we get each day versus how many tests we've done. We have seen that number remain relatively consistent. So that kind of gives us some measure of whether or not we're picking up more positives or not. As far as the question about social distancing, I'm hopeful. Once again, I said we need to watch that case count as a daily trend, and as a trend and not as a daily output. Once again, I think that social distancing, we have a reason to be helpful that this is working. I want to remind everybody that this doesn't mean we can lessen up on any of this. We still need people to stay home and only come out for essential activities. Thanks.
Well, and lastly, the county medical update notes that several hospitals are in the red or limited zone when it comes to capacity and potential issues with patient care. Could you describe kind of what that red zone or limited zone means and kind of translate that into English for us?
I actually don't know what you're referring to as far as the red zone. Our hospital capacity right now, most of our hospitals are running at relatively low capacity, and that's by design. We've asked individual hospitals, actually as a whole, to cancel elective procedures so that they might have capacity for a surge. And from what I know, the hospitals still have plenty of capacity for treatment at this time.
Okay, thank you, Dr. Quick.
Is there free testing being offered in anywhere in the county?
Sure. I'll ask Dr. Quick to come up and respond to that.
So let me speak to what we do at our public health lab right now. Our public health lab works in conjunction with providers in the community on a daily basis to evaluate potential individuals that may be symptomatic from C19 and to see if they qualify for testing. If we run a test in our public health lab, we never charge for that. I can't speak to every testing site that has been potentially set up in Orange County. Individual health systems or hospitals may have testing sites that have been set up to test for test individuals within their health system. But once again, we never charge for a test for C19 at our public health lab.
And I know that some other areas have been able to examine the data coming in from these test sites and kind of group them from demographics. We're learning that some groups appear to be more affected, adversely affected than others. Is Orange County doing anything to analyze data coming in from their testing sites?
Sure. So let me kind of give you, and I'm going to read my paper here because this is new for us. We are also trying to look at test results by demographics and what you're referring to as race and ethnicity. We do have, and I think the key point for this is out of the tests that we have so far, we have demographic information for just under 50%. So some of this is certainly incomplete data. We will start reporting that data on our website, but we generally have a breakdown. The vast majority of individuals who we have tested are either Hispanic, Latino, that is 12%, unknown once again is 52%, and white is 21%. And once again, we will try to get this information on our website, and I want to reiterate that this information is only about half, a little under half the number of tests that we have done.
Great, thank you so much.
Next we go to the line of Martin Wiscol. Please go ahead.
Hi, this is Martin Wiscol, the Orange County Register. I have two pretty short questions. The first one I think is best directed to Dr. Quick, although I welcome any thoughts that Mr. Kim has. There's been concern expressed by grocers and employees that the reusable bags that customers bring into the stores increase the risk of infection in the stores. In California, at least 8 counties have temporarily banned the use of reusable bags. And some stores, at least one grocery chain in Orange County, has also banned reusable bags from their store, and they're handing out paper bags. Has the county considered taking this step to temporarily ban the use of reusable bags in grocery stores?
Dr. Quick?
Hi there. Thank you for that question. We have pointed repeatedly to the CDC guidance on sort of best practices at this point for businesses, including cleaning and so forth. That, once again, was in the recommendation that was released today for businesses to follow those policies. Specific to a ban on reusable bags, that is not something that I'm aware we have come to a decision or discussed at this point.
Okay, thank you. And the second question is for the District Attorney, Todd Spitzer. I am wondering if, so right now there's at least one grocery chain whose national policy is to ban reusable bags and to provide bags at no charge to the shoppers for obvious reasons, I think. However, the state law and the bag ban requires the stores charge a minimum of 10 cents for any bags they provide to shoppers. So there are some counties, and in Orange County, some stores that are technically in violation of state law. Is this something that you would pursue enforcement of? And if not you, who would be responsible for enforcing this if it were to be enforced?
Thank you for that question, Martin. Good to hear you, Martin. I haven't seen you in a long time. A couple things. First of all, obviously the 10 cents was being charged to deter people from purchasing bags in the store. It was basically an economic disincentive when the legislature passed it, because I think I was in the legislature and I'm pretty sure I voted against it. With respect to your enforcement question, I've made it pretty clear I'm not interested in enforcing certain aspects of the law. For example, social distancing. That's a big question now. If there's an enforced social distancing order like in Los Angeles, or is there going to be arrests? I think there has to be good judgment from law enforcement and from the district attorney's office and city attorneys in the prosecution. I do not want to prosecute people. But if, for example, people are having a kids party and they have a jumpy and they're completely, violating every rule and it's against all social practices, that's a whole different conversation. So to answer your question directly, let's say, for example, on the 10 cents, the state gets 2 cents revenue. If somebody shares in the revenue, that's a whole different conversation because I don't know how that works. But I can tell you if it's just an economic disincentive and a retail establishment thinks it's a best practice, I'm not going to enforce that. Now, could the Attorney General come in and enforce it? Of course they can. Under state law, they also would have jurisdiction. I just don't think anybody's very interested in being that punitive for no good reason. I mean, listen, for goodness sakes, the whole issue during a pandemic is to use good judgment. It's very much like the early release from our jails. No one wants early release from our jails, but we have to use good judgment about reducing the spread of the coronavirus inside the Orange County Jail. So we're making decisions we're not exactly crazy about or we wouldn't do in a normal world, but this is not a normal world. So we have to be good stewards and good judgers of the facts.
Thank you both.
I wanted to ask why the health order regarding covering was not a mandatory one, and why the decision was made to have a strong recommendation. Some experts I've talked to from academia, like UC Irvine and Chapman, say it should be mandatory.
Sure, so thank you for that. At this point in time, the reason I made a strongly recommend versus a mandate is based on what we're seeing numbers-wise, and I'm hopeful that we're seeing a flattening of curve in Orange County. I want to be very clear that there may be in the near future a time where a mandate is more appropriate. So this is something that is going to be continually revisited, but at this time, this is another tool to help slow the spread of C19 in Orange County. I want to talk once again, I want residents to continue doing what they're doing right, which is staying home except for working in an essential business or going out for essential activities. And once again, we all need to be in this together to protect those most vulnerable.
With such a small number of tests being done, relative to the population, how can you be sure that there's evidence of a flattening of the curve?
Yeah, so while testing, once again, we're all limited by the number of testing in the U.S., California, Orange County included. Based on, once again, the number of tests that were done and looking at the percent positive, we are still basing our models and daily readjusting and looking at that. And there's reason to think with that, also looking at our hospitalization and ICU beds, that the trend may be slowing. Once again, it's a trend, so we need to pay attention over the next several weeks. It's not a single point in time that we base these decisions on.
Thank you.
Thank you.
Next question comes from Lana Spencer, Custodio. Please go ahead.
Hi, this is Spencer Custodio with the Voice of OC. This question is for District Attorney Todd Spitzer. With the courts largely closed down, I've been getting questions kind of popping up on how the District Attorney's Office, in conjunction with SSA, would handle elder abuse and child abuse cases. I wonder if you could speak to that.
Yeah, of course. Thank you so much. So we have very limited court capacity. We're prosecuting preliminary hearings. We're doing arraignments. I just want to give a shout out to the presiding judge, Judge Nakamura, Sherry Pham and Judge Maria Hernandez, all three judges. They're doing a phenomenal job. The sheriff and his custodial staff are just doing off the charts good work. I appreciate the question because I've been talking so much about our concern about elder abuse and child abuse. The courts are open for emergency orders. So the courts are still able to handle referrals from social services if they come through for a prosecution for elder abuse or child abuse. So my family law unit that handles those kinds of prosecutions, all of those people are working. Of the 800 people I have in the DA's office, 600 are working from home, and all of them have access to their computer. So we're fully up and running and operational, and we're reviewing all the cases that are coming into us. So my goal is, first and foremost, just like Sheriff Barnes, to protect public safety and do nothing that jeopardizes public safety in any way whatsoever. So if there's a filing, reconsideration, or request on child abuse or elder abuse, my prosecutors will review that. We'll see if there's sufficient evidence, and they will file that in court. Now remember, social service investigations, they still send out investigators. They can still refer to a police agency for an arrest. So our arrests are absolutely down in Orange County. We are seeing a dramatic decrease in arrests. But if a social service caseworker, believes there's probable cause to make an arrest because there's elder abuse or child abuse, whatever the case may be, we're going to go ahead and prosecute that case.
Thank you.
Next we go to the line of Chip Young. Please go ahead.
I'm just taking it off speaker there. Yeah, the first question is for District Attorney Todd Spitzer, and I have one for Dr. Quick, if I could. Todd, you were talking about the differences in the laws of the executive order by the governor on price gouging. Can you just clarify the 10% to 50% rule, the 10% obviously for the people who are in the business of selling something beforehand, but these entrepreneurs that come in, they have a little bit of a higher threshold?
Yeah, so Chip, the governor's order covers the present loophole in state law under Penal Code Section 396. They only covered in that code section individuals who already traded in that commodity before the pandemic. So if an entrepreneur emerges to exploit this pandemic, then their price they can charge is no more than 50% of the fair market value of that commodity in the general marketplace. Now, so that's kind of established by what everybody else charges, which is not necessarily easy to prove because a big box like a Costco price for a roll is a lot different than the corner convenience store and what they pay for it. But the bottom line is it's a market-based price. So that is why I'm working with Senator Umberg, and he's introducing legislation to fix that. But let me just make this kind of general admonition. If you are purchasing goods from an individual whose price is exorbitant, then I need you to call my hotline and let us help you find a place that's trading in that commodity at a fair market price. On my website which is behind me, if you just Google Orange County District Attorney and you go to my website, on our news release tab and information, we have about 30 referrals and agencies that can help you. I don't want anybody sitting at home feeling like that out of desperation, they have to go to the corner store and pay $5 for a roll of toilet paper. Call my number and let us help you get the resources that you need.
And on that note, do you have have you had any churches filing us in one this winter? Do you have any investigations going on right now where you anticipate any churches will be filed?
So we've had, as I indicated, over 130 investigations. What we're doing is when we do our investigation, we look at all the facts I've already described. To date, we have not found somebody who fits in those categories, but we're serving them with a letter. and we're putting them on notice that they're kind of operating in a gray area and they could be coming close to violating the law. So it's not a cease and desist. It's not a over-the-top threatening letter, but it's a way to tell people, be careful, do not exploit the public, and just continue to operate your business. So the answer is no. I was very pleased to see the City of Baldwin Park at least the arrest. I talked to their police chief today, and because I wanted to understand the case better, and that case it's not reported accurately in the news. That case is not being prosecuted under Penal Code Section 396. That is going to be, if it's going to be prosecuted by the LA District Attorney, it will be prosecuted under the governor's emergency order. So the 50% rule, not the 10% rule.
And Dr. Quick, if I'm looking at the numbers correctly that they came out today, it looks like just percentage-wise, based on population, Laguna Beach has the highest percentage of people who have tested positive. My question is, do you have any areas, be it cities, residential neighborhoods, or even nursing homes that are of concern where you're looking at, you're monitoring a little more closely than other places because you've had higher numbers of positive cases?
Sure. So I want to make this very clear. We have ongoing community transmission, and we consider the entire county at risk for COVID transmission at this point. There is not a particular city that we are monitoring more closely. I also want to make the point that we are very closely working with our nursing homes and those congregate living facilities to make sure that we find out about any potential cases, get individuals tested and treated appropriately and very rapidly. So that is an area of ongoing, I'd say, focus that we will continue going forward.
Thank you.
Next we go to the line of Jessica Danova. Please go ahead.
Hi, thank you. I think the first question is best for Dr. Quick, not sure about the second one. But Dr. Quick, we're talking about a very slight chance that we might be seeing a flattening of the curve. On your guys' website, on the county health website, which chart would you say illustrates this trend best? And on what day would you say, the data that you're talking about, what day would you say that you see it best illustrated on? What day does that potential flattening start?
Yeah, so the data that we look at when I talk about flattening of the curve, our curve that you're seeing on the website is too early to tell. Okay, so let me explain it this way. We continue to increase in the number of total cases, which is expected. That's a cumulative case count. The number of new cases per day sort of jumps up and around, and that's because that's based on when labs are reported to us. When we look at flattening of the curve, we sometimes look at a measure called doubling time, and that sort of looks back historically at how quickly our cases were increasing and then how quickly they're increasing now. That doubling time right now appears to be stretching out, which means we have less new cases in the recent past than we did, say, 2 weeks ago. So that information, when you look at our slope of our cases right now, may not be evident, but that's a calculation that we are calculating almost on a daily basis right now.
Got it. Okay. And then I'm not sure if this would be best for you or someone else, but Kaiser Permanente announced the temporary closure of some of its medical offices, and I'm wondering what that means for our surge capacity. Are we worried that maybe some patients that were going to head to Kaiser might now be coming to other hospitals, and does this affect surge capacity at all? Is it something that the county was in conversations with Kaiser?
Yeah, I'm actually unaware of that. I do know from hospital capacity may be different than Kaiser closing some of its office facilities, but that may be a question for Kaiser. Overall, as far as our surge capacity planning, once again, working very closely with the state and our region to ensure that we have the surge capacity that we need percentage-wise at our hospitals as well as at any alternate care sites.
All right, thank you for your time.
Next we go to the line of Margaret Guerrero. Please go ahead.
Yes, it's for Dr. Quick as well. We were talking a little bit about the demographic data with regard to the number of confirmed cases, but do you also have them for the deaths
Sure. So I do have it for deaths as well, and I'm going to read because this is brand new information that we just got. Once again, we have 17 total deaths at this point. I can go through the list quickly for you. 35% or 6, and this is race ethnicity, were Asian. 3 were Hispanic or Latino. Other was 1, and then once again the unknown was 5, so significant number that we don't have that data for, and then white was 2. And yes, this data will be made available, and as we get more of this information, we will update that and get sort of a better picture of what this looks like, because once again, we have a significant amount of this demographic data missing from both our cases and our deaths at this time.
And when do you intend to have it up on the website, that information?
Oh, it's up now, so you can go there right now and see it.
Next question comes from the line of Matthew Leslie. Please go ahead.
Hi, Matthew Leslie, Fullerton Observer. I have a fairly basic question about the number of cases per city. In looking at the list, someplace like Laguna Beach, as was mentioned earlier, has a higher percentage of people testing positive. Whereas if we look at say, Santa Ana, which has a very dense population, there are a lot fewer per population. Is it accurate to assume that this is just because people in wealthier cities are being tested more? And do we know how many people in each city are being tested?
So I don't think that the assumption would be just that wealthier people are being tested more. There's probably criteria that individual health plans as well as the public health lab are using. As far as number of tests per city, that is not data that I have right now. And once again, I want to point out that across the state of California, in all of the state of California, as well as in the counties, less than 1% of the population has been tested. So these variations by county or even by city, we still are only testing a very small portion of the population right now. And really for the public, the most important message is that the risk of transmission in Orange County is county-wide. It isn't varied by the city location.
I'd like to thank everyone for participating in our press conference. And again, I would like to remind you, if you come to our website, ochealthinfo.com, just as we were in this press conference, they did update the data so that ethnicity and racial demographic information was posted while we were in the press conference. So if you check that website today, you will see that new information. Thank you all very much.